Hello friends, this is Ms. Shahid Ali Khan and I'm from GMM12, and today my topic of presentation is chemotherapy. Chemotherapy is an aggressive form of chemical drug therapy it is meant to destroy rapidly growing cells in the body. It is usually used to treat cancer cells, the abnormal cells actually. So cancer cells grow and divide faster than other cells, and as you know, cancer cells are abnormal cells. It is a method to destroy those abnormal cells. So we are here to compare the normal cells. So normal cells have the comparison between the normal cells and the cancer cells, guys. So normal cells are small. They have uniformly shaped nuclei, relatively low cytoplasmic volume, and if we look into the cancer cells on the other side, so they have large variable shaped nuclei, relatively small cytoplasmic volume. Now let's come to the normal cells again. Point number 2 is conformity in cell size and shape, cells arranged in discrete tissues. And if we look into the cancer cells here, so variation in cell size and shape, disorganized arrangement of cells. And now number third point in normal cells is many possess differentiated cell structures, normal presentation of surface markers. And point number 3 in cancer cells is loss of normal specialized features, elevated expression of certain cell markers. Point number 4 is in normal cells, lower levels of dividing cells, cell tissues clearly demarcated. And if you look into the cancer cells, point number 4 says large number of dividing cells, poorly defined tumor boundary. So if you look into the diagram right now, so you can see the normal cell structure also, the cancer cells here, and in the bluish form you can see the cancerous cells here. So yeah, so if we in the normal cells we have, guys, Golgi apparatus, chromosome, nucleolus, and these are the organelles inside the cell cytoplasm, mitochondria, and the nuclear membrane is double membrane surrounding the nucleus. And so we have nucleus, endoplasmic reticulum, cytoplasm, and the cell membrane, or you can say the plasma membrane, which is a lipid bilayer membrane. So this is the basic structure of cell. Now guys, we will discuss how does cancer form. You can see in the picture that there's on one side there's normal cells, on the other side there's cancer cells, right? So what are oncogenes? And so cancer is disease in which some of the body cells grow uncontrollably and spread to other parts of the body. DNA repair genes are involved in fixing damaged DNA cells with mutations in these genes tend to develop additional mutations in other genes and changes in their chromosomes, such as duplications and deletions of chromosome parts. Together, these mutations may cause the cells become cancerous. So, what are tumor suppressor genes? So, the tumor's microenvironment, TME, is the environment around a tumor. Okay, so including the surrounding blood vessels, immune cells, fibroblasts, and signaling molecules, and extra cellular matrix. The tumor and the surrounding microenvironment are closely related and interact constantly. Tumors can influence the microenvironment by releasing extracellular signals, promoting tumor angiogenesis, and inducing peripheral immune tolerance, while immune cells and the microenvironment can affect the growth and evolution of cancerous cells. So what is the other topic we're gonna discuss is what is metastasis, right, guys? So cancer that spreads from where it is started to a distinct part of the body is called metastatic cancer. Okay, for many types of cancer it is also called stage 4 cancer, which is the last stage of cancer also, guys. The process by which cancer cells spread to other parts of the body is called metastasis, right? So Many different kinds of chemotherapy or chemo drugs are used to treat cancer, either alone or in combination with other drugs or treatments. These drugs are very important and their chemical composition, like what are they made of, how they are prescribed and given, how useful they are in treating certain types of cancer, and the side effects they might have. Every time any new cell is formed, it goes through a usual process to become fully functioning or mature. So this process involves a series of phases and is called the cell cycle. So chemotherapy drugs target cells at different phases of the cell cycle. Understanding how these drugs work helps doctors project which drugs are likely to work well together. Doctors can also plan how often dose of each drug should be given based on timing of the cell phases. So uh, guys, cancer cells tend to form new cells more quickly than normal cells, and this makes them a better target for chemotherapy drugs. However, chemotherapy drugs can't tell the difference between healthy cells and cancer cells. This means normal cells are damaged along with the cancer cells, and this cause side effects. Each time chemo is given, it means trying to find a balance between killing the cancer cells in order to cure or control the disease, and sparing the normal cells to lessen the side effects. The good news is the most normal cells will recover from the effects of chemo over time, but cancer cells are mutated cells, guys, and they usually do not recover from the effects of chemo. This is why chemo is good at killing many types of cancer cells. So here we now going to discuss the class of chemo drugs. So alkylating agents, platinum compounds in nitrous, sodium, antimetabolites, cyclines, and antimicrotubular agents, Venza alkaloids, antioxidants, topoisomerase inhibitors, anti-tumor antibiotics, anthracyclines, corticosteroids, and other chemotherapy drugs. So, yeah, these are anti-cancer drugs. And now we classes of different drugs and their examples, their biochemical activity. We're gonna discuss their biological effects on human body and use in clinical oncology. So, antimetabolites. Number one is antimetabolites. It's fluorouracil, gemcitabine, methotrexate, and its biochemical activity is analog of pyrimidine nucleoside, inhibits dihydrofolate reductase, and its biological effects are preservation of RNA and DNA synthesis, reduction of folates required for DNA synthesis. Used in clinical oncology is called colorectal cancer, pancreatic cancer, and non-small lung cancer, small cell lung cancer, pancreatic cancer, bladder cancer, and breast cancer. And so, methotrexate, clinical oncology is breast, head and neck, leukemia, lymphoma, lung, osteosarcoma, bladder, and trophoblastic neoplasm. Alkylating, number two is alkylating agents. This is cyclophosphamide. Its biochemical activities adds an cargo to DNA, inhibition of DNA replication, and lymphomas, leukemias, and brain tumors at its clinical use. So the carbazine and melphalan says no, it has no biochemical activity, none biological effects, and also it has a use in oncology. Mean clinically it is used against multiple myeloma, and it is also multiple myeloma, metastatic melanoma, and Hodgkin's lymphoma, vein cancer, and malignant melanoma. So number third is anthracyclines. As example is doxorubicin. Its biochemical activities, intracellular base pairs of nucleic acids, and inhibition of RNA and DNA synthesis, biological effect, and in clinical uses against leukemia, Hodgkin's lymphoma, bladder cancer, breast, stomach, lung, ovaries, thyroid, soft tissue sarcoma, multiple myeloma. As the other is antimicrotubule agents. As example is when blastine binds tubulin, thereby inhibiting assembly of microtubules. Its biochemical activity and its biological effects are MPH-specific cells arrest by disrupting microtubule assembly, Hodgkin cell, lymphoma, small cell lung cancer, breast cancer, head and neck cancer, and testicular cancer. It is its clinical use. The other is platinum compounds, cisplatin as cross-links DNA strands, inhibitors of DNA replication and transcriptions, biological effect, and it is clinical oncology is head and neck, lung, and skin cell carcinomas, lymphomas, and germ cell tumors. Other stabilizes GDP-bound tubulin and microtubules, inhibition of mitosis, and is lung or breast, head and neck cancer, advanced forms of Kaposi sarcoma. And the other one is topoisomerase inhibitors. So there comes examples edoxatecan, etoposide, phosphate, and metoxantrons. Okay. So its biochemical activities interferes with type 1 topoisomerase, including DNA strands breaks, and yeah. So cell cycle arrest and apoptosis is biological effect, and colorectal cancer is its clinical use. Other one we have so interferes with type 2 topoisomerase, including DNA strands breaks. Kaposis and image sarcomas, certain leukemies, lung, ovarian, gastrointestinal cancers, and glioblastoma multiforme, metastatic breast cancers, acute myeloid leukemia, and non-Hodgkin's lymphoma. So, guys, that was all. Now we're gonna discuss alkylating agents. So, alkylating agents, right? So, DNA alkylating medications. They are anti-cancer agents on one side of this. So, these are the different drugs that are DNA alkylating medications, as we know. So, guys, alkylating agents keep the cell from reproducing by damaging sDNA. So it's just the agents that keep the cells from reproducing, reproduction is making copies of itself by damaging its DNA. So when we damage the DNA of a cell, so definitely cells will not reproduce, cells will not replicate. So these drugs work in all phases of cell cycle and used to treat many different cancers, including cancers of the lung, breast, and ovary, as well as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, and sarcoma. Because these drugs damage DNA and can affect the cells of the bone marrow, which make new blood cells, and in rare cases this can lead to leukemia. The risk of leukemia from alkylating is dose dependent, meaning that the risk is small with lower doses, but because of the total amount of drug used gets higher. The risk of leukemia effect after getting alkylating agents is highest about 5 to 10 years after treatment. So these are the different alkylating drugs agents. So ultratamine, bendamustine, busulfan, carboplatin, and we have carmostine, chromobucil, chlorambucil, cisplatin, and cyclophosphamide. So platinum compounds. Now we discuss platinum compounds. Platinum-based neoplastic drugs, and formerly called platins, are chemotherapic agents, means used to treat cancer. It is used to treat cancer. There are coordinations complexes of platinum. These drugs are used to treat almost half of people receiving chemotherapy for cancer. In this form of chemotherapy, commonly used drug use is included cisplatin and oxaliplatin and carboplatin, but several have been proposed are under development. Additional platinum-based chemotherapy drugs to chemoradiation in women with early cervical cancer seems to improve cervical and reduce risk of recurrence. Cisplatin. The mechanism of action of cisplatin has been associated with ability to cross-link with the urine bases on the DNA to form DNA adducts, preventing repair of DNA, leading to DNA damage, and subsequently induces apoptosis with cancer cells. Administration rate is varied from 15 to 120 minutes for infusion, 1 milligram per minute infusion, 6 to 8 hours infusion, 24 hours infusion, or for protocol. Cancer of cervix, endometrium, prostate cancer, esophagus, prostate cancer, esophagus cancer, kidney, non-small lung cancer, head and neck, squamous cell cancer, osteogenic sarcomas, bone marrow transplants is 75 to 100 milligram per m square for of weeks when used with cyclophosphamide. So yeah, BSA is actually, is from body surface area for men of 1.91 square meter and 1.7 meter square for women. So next topic we have ultratamine. Okay, guys, so ultratamine drugs. Ultratamine capsules may be administered either by 14 or 21 consecutive days in a 28-day cycle. It does up to 260 mg per meter square per day. The total daily dose should be given as 4 oral doses after meals and at a bedtime. There is no pharmacokinetic information supporting this dosing regimen and the effect of food on hexalin. Capsules viability or pharmacokinetics has not been avoided. Side effects is nausea and vomiting, generally peripheral neuropathy and central nervous system symptoms, mood disorders with consciousness, ataxia, dizziness with leukopenia and thrombocytopenia. So yes, guys. So that was leukopenia and thrombocytopenia. So now, our next topic of discussion is nitrosoureas, are a group of alkylating agents that have a special action. The other alkylating agents listed above cannot travel into the brain, but nitrosoureas are able to do so, and that travel to the brain. They can enter the brain because they are able to cross through the area known as the blood-brain barrier, special area that keeps most drugs out of the brain. So there is special, like certain drugs do not go to the brain. So yeah, these are special drugs that go to the brain and share its effects. So this action makes these drugs useful in treating certain types of brain tumors, right? So these drugs are carmostane, lomustine, and streptozocin. Indications we're talking about for injection is indicated is palliative therapy, single agent or established combination therapy in the following: brain tumor, glioblastoma, brainstem glioma, medullostoma, astrocytoma, ephendyoma, metastatic brain tumors, multiple myeloma is a combination with prednisone, relapsed and refractory Hodgkin's lymphoma in combination with other approved drugs, relapsed and refractory non-Hodgkin's lymphomas in combination with other approved drugs. The recommended dose of BICNU a single agent in previously untreated patients in 150 to 200 milligram per meter square intravenously every 6 weeks. Administered as a single dose are divided into daily injections at 75 to 100 mg per meter square in 2 successive days. Lower the dose when BICNU is used with other myelosuppressive drugs or infusions in home. Bone marrow reserve is depleted. Administer BICNU for the duration according to the established So common side effects of BICNU include nausea, vomiting, headache, flushing. Injection site reactions means there must be an injection site. There can be pain, swelling, redness, or darkness of the skin color. Antimetabolites, we're going to discuss. Antimetabolites interfere with DNA and RNA by acting on as a substitute for the normal building blocks of RNA. When this happens, the DNA cannot make copies of itself, and a cell cannot reproduce. They are commonly used to treat leukemias, cancers of the breast, ovary, and intestinal tract, as well as other types of cancer. Antimetabolites include azacitidine, 5-fluorouracil, and 6-mercaptopurine, capecitabine, cladribine, and clo- cloparabine, cytarabine, and decitabine, fluoxetine, and fludarabine. So these are included and anti-metabolites. So the generic name here is for the following drug is azacitidine, azacitidine, and its brand name is Vitasa. So yeah. Common risks, if we talk about common side effects of this drug include pure chills, bruising, other signs of low blood cells count, low blood cell count, lung infection, low potassium, nausea, vomiting, stomach pain, loss of appetite, constipation, diarrhea, joint pain in your arm or legs, feeling weak or tired, dizziness. So, Vidasa is indicated for treatment of patients with the following French, American, British myelodysplastic syndrome, subtypes of refractory anemia or refractory with ring-sider blast F, accompanied by neutropenia or thrombocytopenia or requiring transfusions. Refractory anemia with excess blast are refractory anemia with excess blast and transformation, and chronic monocytic leukemia. The recommended starting dose for the first treatment cycle for all facial gases of baseline hematology laboratory values is 75 mg per meter square subcutaneously or intravenously daily for 7 days. Repeat cycles every 4 weeks. The dose may be increased to 100 mg per meter square if no beneficial effect is seen after 2 days treatment cycles and if no toxicity other than nausea and vomiting has occurred. It is recommended that patients be treated for maximum 4 to 6 cycles. Anthracyclines. So anthracyclines is a class of drugs used for cancer chemotherapy that are extracted from Streptomyces bacterium. These compounds are used to treat many cancers, including leukemias, lymphomas, breast, stomach, uterine, ovarian, bladder cancer, lung cancer. The first anthracycline discovered was daunorubicin, trial name daunomycin, which is produced naturally by Streptomyces bacterius, a species of actinobacteria. Clinically, the most important anthracyclines are doxorubicin, daunorubicin, and epirubicin and edorbicin. So, anthracycline chemotherapy medicines are adrenomycin, chemical name doxorubicin, alins, chemical name epirubicin, doxel, chemical name doxorubicin, daunorubicin, brand name serobidine, and danuzome. So metoxantrone, brand name is Noventron. And antimicrotubular agents, highly dynamic mitotic spindle microtubules are among the most successful targets for anti-cancer therapy. Microtubule target therapies, drugs including paclitaxel and vinyl alkaloids. Alkaloids were previously considered to work primarily by increasing or decreasing the cellular microtubule mass, although these effects might have a role in their chemotherapeutic actions at lower concentrations. Microtubule targeted drugs can suppress microtubule dynamics without changing microtubule mass. This action leads to mitotic block and apoptosis. In addition to the expanding array of chemical diverse mitotic agents, some microtubule targeted drugs can act as vascular targeting agents, rapidly depolymerizing microtubules of newly formed vasculature to shut down the blood supply to tumors. So, taxanes are a class of diterpenes that were originally identified from plants of genus Taxus and features a toxidine core. So, mechanism of action of taxanes is reduce the critical concentration of tubulin required for microtubule assembly. That just reduce the concentration of tubulin protein which are required for assembly of microtubules, resulting in a mitotic block at the metaphase and apase junction and a cell cycle for specific activity. In addition to cytotoxic activity, anti-angiogenesis is another mechanism of anti-tumor activity. Paclitaxel and docetaxel are widely used as chemotherapy agents. Paclitaxel is an anti-neoplastic agent where X inhibitor of cellular mitosis and which currently plays a central role in the therapy of ovarian, breast, and lung cancer. Therapy with paclitaxel has been associated with a low rate of serum enzyme elevations, but has not been clearly linked to loss of clinically apparent acute liver injury. Previously untreated 175 mg from intravenously and intravenously over 3 hours every 3 weeks. 135 mg for intravenous intravenously over 24 hours every 3 weeks per weight assess platinum. Previously treated whereas a regimens exist 134 to 175 mg per meter square intravenously over 3 hours every 3 weeks. Common side effects of paclitaxel include hair loss, anemia, joint pain, muscle pain, diarrhea, nausea, vomiting. So yeah, numbness and tightness in extremities, low blood platelet counts, that means thrombocytopenia. Topoisomerase inhibitors, so DNA topoisomerase. Isomerases are enzymes that regulate DNA topology and are essential for the integrity of the genetic material during transcription, replication, and recombinant processes. Inhibitors of the mammalian enzymes are widely used anti-tumor drug. They stabilize topoisomerase DNA cleavable complexes by hindering the DNA religant steps of the site. Catalytic reactions is resulting in DNA cleavage stimulation divide in top1, top2A, top2B. So these inhibitors in topoisomerase inhibitors include etoposide, tesan, tenepsoid, and topotecan. So yeah, I will discuss irinotecan, and so injections solution 100 milligram per milliliter, regimen 1 weekly 125 mg per meter square, intravenously infusion or 90 minutes on days 1, 8, 15, 22, and then 2 weeks often repeat. Regimen 2 once every 3 weeks, 50 milligram 350 milligram per square meter intravenously infusion or 30 to 90 minutes a week for 3 weeks. Common side effects are hair loss, constipation, stomach pain, upset stomach, throwing up, feeling less hungry, feeling dizzy, sleepy, tired or weak, trouble sleeping, headache, mouth irritations, mouth sores, back pain, sweating a lot, weight loss, and gas. Other types of drugs used to treat cancer. Other drugs and biological treatments are used to treat cancer but aren't considered chemotherapy. They often have different side effects than chemotherapy. Many are used along with surgery, chemo or radiation therapy. Targeted therapies work by finding specific substances called proteins or receptors that some cancer cells have. The proteins or receptors is precisely targeted by drugs, and normal cells are not affected by drug. This is different than how traditional chemotherapy drugs work. Targeted drugs can be used as the main treatment for cancer, or they may be used as the treatment to keep the cancer cells under control or keep it from coming back. Hormone therapy. So, drugs in this category work on different actions of hormones that make some cancer growth. These drugs are used to slow the growth of certain breast, prostate, and endometrial uterine cancer, which normally grow in response to natural sex hormones in the body. They work by making the cancer cells unable to use the hormones they need to grow, or by preventing the body from making the hormone. Immunotherapy is another therapy, is a type of treatment that uses drugs to boost or alter a person's immune system. These drugs are used with certain types of cancers to help patients' immune system recognize and attack cancer cells. So this is all for my today's topic, and it was all about chemotherapy. So thank you for your attention, and thank you so much. This is me, Shahid, from GMM12, and thank you so much for watching.